Hello team, I am Greg Wood, President and CEO of Scotland Healthcare System and the current chair of the Coastal Alliance. You know, back in February we had a big celebration here at Scotland for my 30th year as CEO. Remember the good old days when we used to get together to meet, talk, and celebrate? Well, 30 years ago, CCHA also started when Leo Pettit, a very colorful and visionary CEO, convened several regional CEOs and convinced us that working together in an organized manner would benefit all of us more than competing. I bet there are only a few people out there besides me who remember that. And 30 years later, Leo was right. Our initiatives and teams, be they the standard savings from group purchasing or innovative programs like our mobile SIM and SAME programs, have greatly benefited our organizations. But much more importantly, our communities and the citizens we serve are much better off. Let's not forget our sister organization, our Health Information Exchange, and the great improvements in treatment that easier data sharing creates. As Leo observed 30 years ago, when talented leaders with the right values come together, much good happens. Thanks to each of you for helping CCHA help us, and in turn making our region and our communities better. Happy anniversary to CCHA. I look forward to celebrating together next December. In the meantime, please keep yourself, your family, and all safe this holiday season by masking up, standing back, and washing often.
Hi, I'm Yvonne Hughes, CEO for Coastal Carolinas Health Alliance and Coastal Connect Health Information Exchange. And on behalf of myself and my team, I'd like to say thank you to our partners, our members, and our communities for the heroic work that you've done throughout the pandemic. During these unprecedented times, your commitment to each other has been remarkable. Your dedication to keep our community strong has remained steadfast. Our CCHA project teams provides a platform for our regional leaders to come together to share best practices, ideas, experiences, and create new ideas. And while COVID-19 has been extremely challenging, it's also provided an opportunity for these leaders to come together, to share experiences, and to enhance the way locally and regionally you've responded to the pandemic's challenges. And we are so excited that this is the 30th year anniversary of Coastal Carolinas Health Alliance. What started off as a handful of hospital CEOs coming together to discuss how they could support and help each other locally has grown into a nationally recognized strategic network partner that collaborates with hospitals, physician practices, public health, community leaders, academic institutions, and many others. While we cannot get together this year and celebrate Alliance Day in person, we hope this video is a reminder of the great work that you've supported this past year and the tradition that you've supported for the past 30. Thank you.
A lot has changed over the past year. Healthcare has looked very different during the COVID pandemic. It's a new landscape for us, and it's still changing. We have to keep our distance. Interactions have to be conducted differently. Alliance Day looks different, people meeting in many different places. But this isn't new. Alliance Day has looked very different in the past, too. Like you, CCHA has had to adapt. During the pandemic, our team worked remotely and met virtually. Project teams met by phone or webinar. Community health, critical access hospitals, foundation directors, focusing on COVID prevention, testing, tracing, staffing, and funding. Our Coastal Connect Health Information Exchange developed customized COVID reports and heat maps based on patient zip codes. Our annual residence reception event went virtual, connecting medical residents with hospital recruiters across the region. One thing that didn't change during COVID, the dedication of our members. We continue to partner with them to make 2020 another successful year. We met our savings goal of $2.5 million. Our mobile simulation program rescheduled trainings to meet our target utilization. We received a grant to provide simulation training at skilled nursing facilities. And another grant to take primary care services to farm workers across the region. Coastal Connect continued to provide access to health data, alerts, and reporting, supporting nearly 5,000 users at over 280 points of care. Our Sexual Assault Nurse Examiner initiative continued to train nurses at regional hospitals. The Carolinas Amateur Radio Emergency Service held monthly training nets to ensure equipment and operators are ready in case the worst happens. We are 30 years old this year, and an organization like ours doesn't make it to 30 unless it has something special, a unique approach, a special partnership, people setting aside competition to collaborate in new and exciting ways, a willingness to innovate and be cutting edge, while maintaining a trust to share the burden and rise to the challenge together. In short, it's our DNA, made up of people who are dedicated, collaborative, forward-thinking, and regionally focused. It's what has allowed us to serve as your strategic networking platform for 3 decades and launch nationally recognized programs and initiatives. So this year, we celebrate you, our members, in a partnership that is 30 years strong, as we look forward to the next 30 years working by your side.